So a quick question for you, Norman. When did you last have a skin cancer check?
6 weeks ago.
Oh, such a good answer. It's more like 6 years in my case. And I really feel like I need to get one done based on what I'm about to talk about, because a recent study has projected that melanoma incidence is going to increase by 50% in the next 2 decades. But the question is, who's going to treat it? The Australasian Skin Cancer Congress has been discussing just this over the weekend. And part of the conversation was cancer epidemiologist Michael Kimlin, who joins us now. Hi, Michael.
Hi, how are you?
Good. So the study was published in JAMA Dermatology, as in the Journal of the American Medical Association, and it's global increases in incidence. How do we know how Australia might compare to that global average?
Well, look, certainly those projections would hold true for us. And I think the other reassuring evidence is that there's work recently conducted at the Queensland Institute of Medical Research, and they're expecting skin cancer cases in Australia to grow annually by 6% over the foreseeable future.
So what's driving this increase? Aren't we better at preventing skin cancer than we used to be? It's slip, slop, slap taught us nothing.
Yeah, look, we really are doing a great job with primary prevention of skin cancers in the community. We've got a highly educated community who's aware of the risk factors, and we've got these great policies like no hat, no play in the primary school setting. I guess what's driving these cases is an ageing population. We're going to be seeing a group within the population who weren't necessarily exposed to those early messages of Sid the Seagull in the early 1980s. So those folk are getting older, and they're starting to reach that age at which skin cancers become far more prevalent within that age group. So it's an effect of aging as well.
Right. So this 20-year progression projection that you've been talking about, it's sort of too late for prevention in that group of people. Is that what you're saying?
Yeah, well, look, it's never too late, and we know that with skin cancer at any stage in life, any additional prevention measure does make a difference to your overall risk. But certainly on a population level, we're finding this aging group is moving forward, and this is coming towards us and our healthcare system into the future.
So the big discussion that you had during the Congress over the weekend was about whose job is it going to be to take care of all of these people. Is the answer simply training more dermatologists, or are there different models of care that you've been toying with?
Certainly, look. There was lots of conversation around, and I think around this issue, and I think the main outcome is that it needs many shoulders to the wheel, and it needs a national conversation around how we're going to address the workforce that's going to be required in order to address these incoming cases. Because, you know, we have a workforce both within primary care and specialist care, certainly completely under the pump at the moment with our already saturated levels of skin cancer within our population. Just a reminder, it's our national cancer. It's the most costly cancer that we have, skin cancer, within Australia. So, how are we going to keep our workforce, both primary care and specialist care, primed and ready to adapt to this aging cohort that's coming into the future? So I think it's more than just one. It's many shoulders to the wheel, so to speak.
So primary care's like, we're talking about GPs, they're already pretty
hmm
pretty, they've got a lot of work on their shoulders that you're asking them to put to this wheel. Like, is that a reasonable solution to this problem?
Well, look, typically we find that most folk with concerns or issues around skin cancer tend to see primary care setting as their first port of call. And many GPs have actually invested substantial amounts of time and their own money to develop their specialist skills in skin cancer practice. So, thinking about um, giving GPs not extra work, but a way of actually recognising those extra skills and time that they've spent developing their practice into a robust accreditation system that can give the consumer a tick or a confidence. I think is something that we should talk about.
And briefly, when it comes to melanoma specifically, if you can get it early, it saves a lot of money as well as heartache down the track.
Yeah. So early, the evidence is very clear. early detected melanomas have fantastic survival rate, close to 100%, not always, but close to 100%, and good outcomes in the longer term. The more advanced melanomas, we go from around about $650 to treat an early stage melanoma per annum, per patient, to up to around about $100,000 per patient per annum to treat these advanced melanomas. So certainly early detection of those melanomas is better economically as well.
Michael, thanks so much for joining us.
Thank you for your time.
Professor Michael Kimlin is a cancer epidemiologist at Queensland University of Technology. Aren't you glad you got that skin check, Norman?
I am indeed, thoroughly relieved.
It's easier than ever to hear your favourite local and national ABC radio stations, live and on demand on the ABC Listen app.